Hi everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Healthcare in Spirit Lake, Iowa. It's the 8th of June here, and just wanted to give a little update on where we are in terms of our local and some broader perspectives on coronavirus. I'm going to take my mask off. Again, we're 6 feet apart or more, so I feel safe doing that. So coronavirus has been in the news here locally. As you may have seen, we are up to 55 cases in the county as of this morning, and that is people who have given their addresses as Dickinson County. There are certainly more who work in the county who have tested positive, or who have visited the county and then gone back to their homes, or might actually be staying here for some time but have still given their address as out of the area. So it is here. I know I've been saying this over and over, and I think we're actually seeing that it is confirmed to be here. In the last week, we have gone up by 33 cases, so we have more than doubled in a week, and I think that is going to continue, unfortunately. We got prepared over the last 3 months for this. We are confident in our ability to handle cases here at our hospital, and we are confident in our screening system and testing system, which we'll go into a little bit. But big picture, it is here in our community. So we are getting often hundreds of calls each day with, I know someone who has tested positive, how do I get tested? I heard that my brother-in-law's sister who works with this person might have been affected, what do I do? So I want to talk a little bit about what you do, and also put out a plea that we continue to treat this as the true public health emergency that it is. The risk has just gone up here rather than going down. So while it seems as if everyone's back to normal, things are not normal. So I want you to just listen a little bit, and I appreciate your time. So again, 55 cases here in the county. That will likely be higher by this evening. There are many tests that are still outstanding, both at Test Iowa and here from the hospital. And so I just want to go a little bit into how you get tested if you think you might have been exposed or if you have symptoms. So again, the symptoms, as we've talked about before, fever, cough, shortness of breath, and then there are a number of more minor symptoms that are still linked. So sore throat, fatigue, chills, nausea, vomiting, diarrhea. So if you have a few of those, or if you have the cough, shortness of breath, or fevers, we encourage you to call our respiratory hotline at 712-336-6696 between 8 and 5, Monday through Friday. If you get a machine, you will get called back, but again, those phones are ringing off the hook right now. And so please be patient. We will get back to you as soon as we can. If you need to just call the general clinic for something non-related, it's 712-336-3750. That's for folks who have symptoms. So if you think you have symptoms, call and you'll be assessed by a nurse and we'll get you tested. If you do not have symptoms, but you have a known exposure to someone who has tested positive, of which we are seeing more and more because the social distancing has relaxed a little bit and more people are being exposed, then you can also call the respiratory clinic, and you may be tested either in a drive-up setting with a virtual visit with one of our nurse practitioners, or you may be asked to come in as well. But we will get you seen and get you taken care of. We are doing tens of tests each day, sometimes more than 20, sometimes even more than 30. We have the testing capabilities right now to do so. Can't confirm that it will always be that way, but we feel pretty confident in our supplies both from Vera and from the state. So again, if you know you've been exposed and you're feeling well, you should still be tested. And ideally, if you've been exposed, you would be out of work until, or sort of quarantining yourself until you have been tested, because many people have no symptoms. So you could be going around living your life, going to work, and spreading it. So please get tested if you have a known exposure. You will be called by the Department of Public Health if you have a known exposure, but sometimes there's a delay. So we're seeing that people are telling their friends that they have tested positive before we've gotten the information from the state and are able to do that contact investigation. So feel free to call 6696, and ask to be tested. Also, if you have symptoms, similarly call that number. Test Iowa is another route that people can get tested in. Currently, the closest locations are in Storm Lake and in Sioux Center, but you go to testiowa.com and go through the assessment, and anyone who wants to be tested can be tested, whether they have a risk or not. So you can set that up to be tested in Storm Lake or in Sioux Center. There can be a delay significantly in terms of when you get those results back. So again, if you think you have symptoms or you know you've been exposed, call us because we can try to get it done quicker, hopefully. The staying home piece and the not going to work piece after you've been exposed is huge. So if you have been in contact with someone in less than 6 feet from them for more than 15 minutes, you are technically likely exposed. So that's in an enclosed space, that's in a bus, that's at work. So assume that you are positive until you know otherwise. So if you've been exposed to someone more than 48 hours ago, you qualify for testing. So please call, get tested, and stay home. The other question that we're getting a lot of is serology testing, so antibody testing. That should be available later this week through the lab at the hospital. We will send out a press release when that is actually available, but we're very excited about that. It's going to be $80 out of pocket to test. We may be able to test through the clinic as well, but that will be available shortly. That will be through Avera using the Mayo platform, which has been validated. It's an IgG test, which shows that you have sort of the delayed antibodies. That said, it's going to be useful for sort of knowing if you had it at some point. It does not necessarily mean that you are immune to getting it again, or that you're safe to go everywhere and do everything. We're not sure how long the immunity that it provides is going to last, and so we're hopeful that it provides long-term immunity, but we don't know yet. So just take it with a large grain or bag of salt. If you test positive on serology, still be cautious. So, I'm going to try to be brief today, so I'm not going to go into all sorts of other things, but we are still open for business. We are getting questions about whether we are going to scale back our clinical services here at the hospital, and at this point, we're constantly reviewing it. The task force on COVID-19 and the administration are continually monitoring the situation in terms of our levels of personal protective equipment, our levels of available beds at the hospital, our staffing. But right now we are continuing to do surgeries, we're continuing to do outpatient procedures, but we will be very transparent and update you as those things change. So if our numbers go down in terms of our availability of personal protective equipment, we may scale some of those services back. We feel confident in the setup that we have put in place so that everyone who enters the facility is wearing a mask, and that anyone with symptoms is being shepherded to a specific area of the hospital rather than up in the main clinics. So we feel confident in that. My biggest ask to you today is to please take this seriously. Okoboji is a wonderful place. We come here to have fun. People come from all over the place. And we have one of the highest hotspots in the last week in terms of per capita infections in the country. So we had, we are a small community, and in terms of the rate of rise, it is going dramatically up. So we've more than doubled in a week. I do not foresee that slowing down, unfortunately. And the way that we can slow it down is to do the stuff that we've been asking you to do and that you've been so good at for so long. So, socially distance. You do not have to go eat at a restaurant. If you choose to, please wear a mask. This is still not the time, ideally, to be hanging out with 300 of your closest friends at the bars. That's my opinion. We know that we're getting lots of calls of, I was at this restaurant or this bar and I heard such and such might have had a case there. It is safe to say that it is throughout the community at this point. There are people who are working or shopping or eating or drinking who have coronavirus probably at every establishment you might go to. So while you might not get severely ill, if you're young and healthy, if you are not wearing a mask, and nor is the person who doesn't know they're sick, you could get it, and then you could pass it along to the people who are going to get sick. So, we thankfully do not have people in the hospital right now with coronavirus. We are testing frequently. We thankfully do not have any confirmed deaths in our county yet, but I think it is a matter of time. So we hope not, but it's up to all of us to stay vigilant and to wear masks. And I truly ask all business owners, if you are not encouraging your staff to wear masks there, please do so. If for no other reason, then it's going to protect your staff and protect your establishment from losing your workforce. But also, if someone is waiting tables and gets sick and doesn't know it, and then they're right in front of older patrons or people who have pre-existing conditions, you don't want your business to be the place where the virus spread. So please take care of your community, as many of the businesses are doing, and ask your workers to wear masks. I think it'll go a long way, and I think a lot of people will thank you for it. So again, our numbers are rising. We appreciate everything that you have been doing. We know we're all sick of this. Everyone wants it to go back to normal, but we're just starting to see it here. And I think in a couple weeks, 55 is going to seem like a very low number compared to where it is. So take care of yourselves, take care of the people you love, take care of each other, and continue socially distancing as best you're able, and continue to wear masks in public if at all possible when you can't be more than 6 feet apart. Thanks for your time, as always, and have a wonderful week.